On day 7 I travelled back to Hyderabad, and then on day 8 I drove east to see the work of Christchip. My first stop was the Sriyesu project, a medical and social centre with the aim of improving the life of people living with HIV/AIDS. One patient at the centre was 9-year-old Balakrishnu, who is HIV positive. When his parents died of AIDS, his next-door neighbour Mrs. Padnavati adopted him. As well as the regular medical care Balakrishnu receives, Mrs. Padnavati receives a foster child benefit to pay for nutritional food and schooling, and an outreach worker pays a weekly visit to their home to check on both of their well-being and offer counselling. Mrs. Padnavati also attends a support group run by the clinic, and has recently persuaded another local woman to adopt an HIV/AIDS orphan. She even ended up persuading Balakrishnu to show me the suit she got him for his 9th birthday. The centre also offers vocational training. This group of HIV positive women didn't have any source of income, and frequent spells of illness meant they were considered too unreliable to be given work. The centre organised handicraft training from members of a local fashion school. With the structural support of Sriyesu, they then formed a small manufacturing business. Sriyesu brought them raw material to get started and created links with the market, exhibitions and distributors. As they progress, they will qualify for a government loan to expand their business and become a financially independent organisation. Throughout this process, the group will be further supported with training in business skills. I then met Balaji Daravath with his parents Venkatesh and Vijaya, who are both HIV positive. Vijaya's first 2 pregnancies ended in the death of her babies because she was not receiving any treatment for her condition, and private doctors refused to deliver the baby due to her HIV positive status. When Vijaya became pregnant for a 3rd time, she came to Sriyesu. She was registered as a patient and started on ART drug treatment, nutritional supplements and given counselling. During the pregnancy, she had regular follow-ups, and the centre facilitated an emergency ambulance service and a hospital delivery. Vijaya and Balaji were also given the drug nevirapine at the time of birth to reduce the chance of the HIV virus being passed from mother to baby. Balaji was born HIV negative, and the family was provided with all the essentials for a newborn baby, as well as continued care and support from Sriyesu. On day 9 I travelled to the village of Tumaguddan to see Lepra's mobile health clinic, which is a jeep with a team of medical staff and volunteers that travel around to villages identified as too remote to access centralised healthcare from. Patients register, have an appointment with a doctor, and are given any necessary medication. Next to the mobile health clinic that day was a celebration for pregnant women organised by the local health committee. There was a speech by a doctor that gave advice on healthcare, immunisations and how to get the nutrition mother and baby need from locally available low-cost food. They were then given blessings of gifts of fruit, sweets and nutritional powder. I caught the overnight bus from Andhra Pradesh into the state of Orissa to arrive on day 10 to see the work of Koralep. My first stop was the Community Care Centre in Koraput. This centre acts as a bridge between home-based care and hospital care for people with HIV/AIDS. There is a small inpatient ward where every morning patients take part in 1 hour's yoga. The centre sees regular yoga as spiritually and psychologically uplifting, and the energy and boost to self-esteem it gives as a vital part of improving the patient's condition. Husband and wife Dambaruda and Subhadra Das are both patients at the centre and are both HIV positive. They are receiving medical and nursing care, participating in yoga and recreational activities, having nutritional meals and attending counselling sessions before going to hospital to start further treatment. The counselling sessions aim to educate them that with the right treatment and lifestyle, HIV positive people can lead an active life. They also attempt to allay their fears of spreading the disease to friends and family with education on the contraction of HIV. Although this has helped them cope, they are still too scared of rejection from their children to tell them of their status, because the widely held view of HIV is of a dirty disease and they fear they would face stigma and exclusion. On day 11 I visited the village of Tenkar and saw how Lepra is trying to help people like Dambaruda and Subhadra through educating communities on the reality of HIV/AIDS. After the drumming attracts a crowd, the Loka Chaitana drama group put on a street play that challenges the myths about how HIV is prevented and spread, and educates on the need to treat HIV positive people just like any other member of the community. This event is organised by the local health committee, but is just one of the ways in which awareness is raised. Another is the Information, Education and Communication, or IEC van. The pictures and text give basic information on how to spot symptoms of various diseases, how to prevent disease, and how to get treatment. Equipped with speakers and an LCD screen, the van can also advertise forthcoming events and show educational films. These visual and entertaining events create huge interest, spreading awareness to the largest amount of people possible, irrespective of language spoken, literacy levels, or remoteness of location.